Hello and welcome to the Queen Elizabeth Patient Podcast. I'm here with Debra Spraggon, who currently manages the South Tyneside and Sunderland Macmillan office, and she's here today to talk about some of the services that is available within the office and what's available in other Macmillan offices in other hospitals. But today she's going to particularly talk about the financial side and how she can help with patients who are dealing with issues related to this and their cancer journey. So hello Debra, and thanks for coming today.
Hiya Carolyn.
Do you want to tell us a little bit about the services at the Macmillan office?
Yeah, we have a lot of services, and most services are supplied from other Macmillan centres across the North East region. So we have access to bandanas, we have the Look Good, Feel Better sessions, which are absolutely amazingly attended. We complete benefits, we do Macmillan Grants, which can be, it's a one-off payment to help people out. There is a lot of support mechanisms out there, so there's a lot of counselling support now and complementary therapy, relaxation tapes, and people don't know that until they actually come through the door, so they get a whole package of care and support aimed at them.
And it doesn't come with a cost or anything like that?
No cost implication whatsoever to the patient. It's all free, and it's all basically what they should be getting elsewhere. So some people access Age UK and they might get the benefits assessments done there. And that's absolutely fine. The more areas that people can visit, like FACT, like Cancer Connections, Macmillan, it's just a huge support mechanism to everybody. And the CNS teams, the cancer nurse specialist nurses, are amazing. They're really concerned about their patients, and they're their referral point, maybe doing a holistic needs assessment for their patient and picking up, there's a lot going on here that they need a lot of support with.
Yeah, and I think especially at the minute with COVID, people are losing jobs, people are in the house a lot more, and I think we've said it before that cancer can be very expensive. Some people go through treatment where they maybe can't walk as far, they have problems with breathing, but I think the thing to remember is that there's help out there, and that they don't need to feel scared or maybe embarrassed about coming along to the centre.
Definitely. One of the things we often say to patients is it's not your fault. If cancer causes you financial difficulty, don't be embarrassed to seek help and support before things get out of control. Because some people do. Some people just put it in the drawer, and we have had patients in the past who've came in with a pillowcase with paperwork in that they've just put away. And when we've had to sit and work through it with them, they were actually entitled to life insurance, which paid out to an extreme amount, and all their worries just literally went away because they had the finance to do with what they wanted to do.
That's great. And I think as well as we know that cancer never just affects the individual being diagnosed, it's often can affect the husband, the wife, the children, the mother, the father.
Yeah, the whole family, the extended family.
Would you say that they're welcome as well to access to the service?
Definitely. We get carers coming in a lot, and we get young people coming in, tend to be 16, 17, who may be the daughter of someone who's got cancer, and it's usually concerns regarding genetics because they don't want to talk to the mums if they're taking priority, or they're worrying about themselves because they want to worry about the mum. But they will often come in and say, I'm really worried because my mum's got cancer. Does that mean I'm going to get cancer?
And I think as well is that if maybe the daughter's worried about the elderly mother, maybe she's doing a lot of the shopping for her, or she's trying to help her with the shopping. Is the services like the Blue Badge, is that a service that you can maybe some help with?
Definitely. We do the Blue Badge applications. What we tend to do is when a person comes in, we'll have a conversation of what the issues and worries are, and benefits advice is always high up on the agenda. I would say a good 70% of our enquiries are related to finance. So we start off by saying there's a lot of government support available. People will ask, can I get help with my rent or my mortgage? And yes, they can. If the pay is now reduced dramatically, they can get support with employment support allowance, universal credit, but each one is done on its own individual merit. But in Sunderland, and I know many of the other centres do now, we have benefits advisors. So they can also look at things such as personal independence payment for people under pensionable age. So as long as they've got care needs and mobility needs, and a good percentage of cancer patients have, we can apply for benefits for those patients, complete all the paperwork with our advisors. And people over pensionable age would be attendance allowance, would be looking at to improve their quality of life as well.
Once you're diagnosed with the cancer, is there a best time to get assessed? You know, because obviously everybody's cancer plan will be different depending on the results and how long that may be. You know, at some point they don't know if they're going to have radiotherapy or chemotherapy, which I suppose will influence the duration of how long they're on treatment. So, you know, if maybe you had a lady who'd just been diagnosed with breast cancer but didn't yet know what the plan ahead, would there still be able to come and get some information?
Oh, definitely. I mean, sometimes it's worth doing an initial assessment, and if things haven't changed, they're still getting full pay, then it's highly unlikely that they will get any access to any benefits at all. But as they move down the line with the treatment pathway and they go on to statutory sick pay and other things that they're really struggling with, they can get access to Macmillan Grant, which is one-off payment, and then have the assessment in relation to personal independence payment and attendance allowance. I think my only concern is, because of what's been going on, we're now getting a lot of palliative patients through at point of diagnosis. So they are able to go straight on to PIP or straight on to attendance allowance.
Just explain to us, what is an attendance allowance?
Attendance allowance is basically for people over pensionable age, and again it's if they've got care and mobility needs. So they have an assessment carried out, and a lot of elderly people will go, I'm absolutely fine, pet, I don't need any help. But then when you get talking to the family, they're doing everything, so they should be getting attendance allowance to help look after their quality of care. So we'll say things to them like, so if your daughter couldn't come today and she couldn't cook you a lunch, how would you manage? And they often go, well, I wouldn't, pet, I just wouldn't have anything. And then you can look at how the care needs are, and then when they get the money, so they're absolutely thrilled, because it just improves the quality of life. They might pay for Meals on Wheels to be delivered instead of giving the daughter, you know, all the hassle of helping out with everything. And then the daughter can have some quality time for herself and not realise she's got to make the lunch every day.
And I think it's just, you know, accessing that information, isn't it? And, you know, sometimes when we understand a little bit more about something, you know, anxiety levels come down, and like you say, it just seems much more manageable. And I think that's great work that you are doing there. And obviously charities have taken a big blow during COVID as well. And if you came into the office, Debra could also advise you if you wanted to maybe raise money or get involved. You know, Macmillan do some amazing charity work. There's something there that they can link up or take any donations that you have as well.
And we also have our own charity now at the hospital. So we've got Rise Above Cancer, which is for Sunderland as well, and obviously Macmillan. And the Rise Above Cancer one tends to just pay for the luxuries of things for patients to help out with when we can. And obviously the big one is the Macmillan one in relation to fundraising to keep that service going, which is just amazing.
Yeah, and it does really, really help. It helps, you know, thousands of people affected with cancer.
Can I just mention as well, there's housing benefit and there's also universal credit. These have now been put in place to help people out, and it helps play with your rent, your mortgage. So it is worth looking at, but people are assessed on their own individual merit. So it's not for everybody, but it can be looked at what finances people have coming into the home.
I think the message is that if you're unsure,
come in.
Just come in.
If you're unsure, come in and we can have a chat and direct you to where you need to be.
Or if people are maybe a little bit nervous about coming at the hospital, especially under the current circumstances with COVID, they can always access the service via telephone.
Yeah, they can access the service via telephone, ringing the hospital, which is 0191 5410 122. Or ringing the main Macmillan helpline, where they can get a vast amount of support, which is 0808 808 0000. That's 8 a.m. till 8 p.m.
And if patients were unsure of the number for their local Macmillan office, they can just use that number and they would be able to put...
They'll be directed.
So, I'll just thank you very much. I think that information's excellent, Deborah, and thank you.
Thank you. Thank you for asking us along. Thanks.